have to turn red. Okay, there it is. Okay, so I haven't done a coronavirus video in a couple of weeks, or maybe not quite that long. And before I get started, I want to comment on a comment that I got on the Fauci video about Tony Fauci needing to be fired. I don't care if somebody calls me warped or dangerous. I probably am the most warped and dangerous person in YouTube channel business. But, what you laughing at? But, it's a family channel, and to the viewer who made that comment, I would just appreciate it if you could go back and delete the expletive. I'm a warped, dangerous expletive, Rich. So I would really appreciate it if you can go back there and delete the expletive, those letters there at the end of that comment. I don't care if it's just the letters. People know what those two letters together means. So I don't want anybody's kids seeing that. So anyway, I've been called worse. So matter of fact, we're gonna call this the Warped Dangerous Channel. How's that sound?
Great.
We're gonna call this the Warped Dangerous Channel. Well, I guess that's the case because I'm right. More and more people are calling for the firing of Anthony Fauci, which is awesome and much deserved, long overdue. And I would also call for the firing of Deborah Birx and Jerome Adams, who are all people who are put in their current positions by Obama and so forth and so on, and they're bureaucrats, and they are not the people who should be making decisions about when the economy ought to reopen. So, I have found out a lot about coronavirus, the misinformation campaign that's out there since the last video. And so, you know what? I'm just going to randomly go through it. And I think that in a half an hour, 20 minutes, we can probably hit all the bases. So, when something pops into my head to talk about, I'm going to go ahead and say it. Okay, first of all, first fact about COVID-19 coronavirus is that Italy and Spain, well, we talk about how correct are the numbers. We've already made a very strong case that the numbers in America are radically wrong. And a big part of the reason for that is the fact that Medicare pays hospitals or even private practices, $17,000 more for a patient who dies when the doctor lists COVID-19 as the cause of death. And then $30,000 does Medicare pay to the same institution for listing the cause of death as COVID-19 when it says on the same form that the patient was on a ventilator. So that doesn't exactly give you a motivation to lie, does it? Well, I think it does. And so what we can automatically assume from that is that doctors will list the cause of death as COVID-19 even if they know COVID-19 wasn't going to kill this person. Person may not have even had it. You'd be on a ventilator for lots of reasons. So, what we established there in the United States is that there is plenty of motivation and temptation to list somebody as having died of COVID-19 when they didn't. So we know the numbers are way off, and we think they're probably under around 2,000 deaths. If that many. I said under 2,000. Okay, so getting back to Italy and Spain. Okay, first of all, the people who run Italy and Spain are stupid, okay? That is just to get started with. The healthcare system in Spain and Italy is a joke. And they are under socialized medicine, which means they have very poor healthcare. So, having said that, what we do know is that the areas of Spain and Italy that were very hard hit were hard hit in areas where there are a lot of very old people. And not only are these people very old, but they are also lifelong smokers, which totally compromises your lungs, which is what COVID-19 attacks. So, having said that, the numbers in Italy and Spain do not reflect what's going to happen in the rest of the world. Okay? So, having said all that, okay, we touched on the fact that hospitals, doctors, they all get money from claiming whether or not someone died of COVID-19 or not. So we know right then and there that many of the deaths are lies. Okay, now, people often ask me, how do you know if someone's lying to you? And I say, well, the biggest thing is you have this ability to be able to think critically. And when you can think critically, that means you question. When you think critically, say, okay, what is a definition for critical thinking? The definition for critical thinking is to question, doubt everything somebody says to you. Everything. You question or doubt the truthfulness of anything anybody says to you unless and until you have an opportunity to research their alleged honesty to find out whether it was honest or not. And what we call this is work. Okay. Now you see, in order to think critically, we have these things that we look for called facts. Facts are derivative of something we call the truth. And a lot of people aren't interested in either. Well, I am. So, and when you are based in facts and truth, and you can think critically, there are certain things that just don't add up. Okay? Good old expression there. Okay. So, how do we come at the truth? Well, the truth, to get to the truth in this day and age, is something that we call work. You have to work to get to the truth. So, Rich is going to chime in here. I'm going to ask Rich some questions here and there, or he can make some grunts or some groans. When we go through the wicked governor of New York, Anthony Cuomo, or is it Andrew? I can't tell. The guy's a lowlife. I'm not really worried what his first name is. But, so, we hear the following statistics. We hear Trump built, 4 or 5 temporary hospitals. Rich, true or false? None of those hospitals ever opened. True or false?
Well, they opened, but were not filled with coronavirus patients.
Okay.
And or not filled to any sort of capacity.
So, the hospitals that Trump built for the coronavirus in New York have never admitted a coronavirus patient. Is that what you're saying? Okay. So, of the 1,000 beds on the ship that they brought in, a total of 200 beds maximum had been used and it's gone down. So, that is 20% at the most of the maximum capacity. And Rich is right. But I do believe that at least 3 of those hospitals were never opened in the first place. 2 of them are being used for non-coronavirus patients. Okay. Then, the Javits Center. The Javits Center, was it you said, Rich, that it wasn't even 25% filled with COVID-19 patients?
Right.
Okay. So, we're going to put our critical thinking cap on here. And knowing what a liar Andrew Cuomo is, we are going to get to the bottom of what he said. Okay, so we have these minuscule numbers of people who are staying in these hospitals where very, very few of them are even COVID-19 patients. So we have doctors that are allowed to lie about the cause of death on doctor's certificates. Okay? Are you tracking me so far? So we have a three-part equation here. We have a very small number of people actually being treated in hospitals for COVID-19 cases in New York. Okay? And then we have a very, very small percentage of the people who have been admitted to the hospital for COVID-19. We've been told both of these things. Okay? And then, all of a sudden, every day, Cuomo announces to the media in his press conference that 700 people just died. Sometimes more than 700 people died. Well, you know what? This one's going to be pretty easy to deduct to get to the bottom of. Say, what is it? Elementary, my dear Watson. Okay, let me get my brain around this. Let me get my brain around this. You have 3 of the 5 hospitals that Trump built not even being used for anything. The other 2 have a limited number of patients, none of them treated for COVID-19. The Javits Center is a ghost town. There's next to nobody there for COVID-19. And less than 200 beds are being used to board the ship. So it would follow that if you are in serious danger of dying from COVID-19, then your rear end would be in one of these hospitals, would it not? Rich?
Yeah.
So where are these 700 people who are dying every day? Where are they coming from? How are 700 people dying every day in New York when there isn't that many people in the hospital? Nowhere near that number. Every day. If Cuomo's numbers were accurate, what was it, 4 days in a row? 700 people died. That's 2,800 people. Okay, now add up the number of people that were actually in the hospital for treatment. Not even 25% of that number. So where are all these dead people coming from? Oh, he says, well, they were at home. Oh, really? Were they? Well, if they're in serious condition and they're at home, why aren't they in the hospital? And then, on top of that, a group of, we call them honest physicians from around the country get their heads together and they say, you know something that's interesting? We thought that those numbers were off too. So we asked ourselves the question, let's look at the death toll altogether in New York City over that span of 4 days. And something very curious happened. Governor Cuomo comes out after being questioned and says, well, these people were all in their homes when they died. Really? Well, A, that doesn't make sense because they should be in the hospital, right? Well, all these physicians looked at the number of people who died in New York City over that 4-day period. And mysteriously missing were all the deaths from heart disease all of a sudden. No deaths from heart disease. How about cancer? We didn't have any of those either. Then we have drug overdose. No, a mysteriously radical decrease in the number of drug overdoses. Well, what about diabetes? What about gunshot wounds? Mysteriously and magically, everybody in New York City just became completely healthy all of a sudden. And everybody who died in New York those 4 days, died of COVID-19. Are you kidding me? How is this even called critical thinking? This is what you call common sense. This is called having a brain in your head. Critical thinking ought to apply to a topic where it looks fishy, but you really have to get to the bottom of it to find out what's going on. This is beyond fishy. So what are we saying? Well, if you need me to spell it out for you, I will. The deaths that are being reported in New York City are false. I thought that's very interesting. How all of a sudden one day there were 5,500 cases of COVID-19 and the next day there were 65,000. And you know what's really interesting about this? What's really interesting about the whole thing is that, okay, we know the death toll, even with all the alleged reported deaths, is nowhere near influenza. What'd you say, Rich? It's over 200,000? 200,000 deaths in 2020 from COVID-19. I mean, from flu. And allegedly, 25,000 from COVID-19. Well, it sounds to me like the flu is a whole lot more serious than COVID-19 is. Why don't we close down the country for the flu every year for 6 months? Huh? Huh? Okay, so the bottom line is this, and we'll get to Fauci more specifically here in a minute. This is not critical thinking. We have what we call an election year. And we have 3 Obama holdovers. We have Jerome Adams, we have Fauci, and we have Birx. Birx, by the way, whose husband worked in the Clinton administration, so that makes her outright a liar. And Fauci is being called on to be fired because he has contradicted the president every possible chance that he has had. Okay, now let me tell you something. On January the 21st, Anthony Fauci said the following thing. We see COVID-19 as not a serious problem for the United States. We don't feel the need at this time to take any action because we do not feel like Americans' lives are in danger. January 21st, 2020. 5 days later on 26, Anthony Fauci says the exact same thing. 5 days after that, Trump closes down travel from China. So, and the next thing you know, Anthony Fauci turns around and says that Trump, the death toll could have been minimized if Trump had taken more decisive action earlier than he did. Well, Mr. Fauci, you said on 2 different occasions that there was nothing to think about. It was a non-issue. No concerns here. And then Trump turns around and leapfrogs you and closes off travel from China. Sounds to me like you're the one who didn't take it seriously enough, pal. And now he's saying this nonsense about if we could test everybody in America as a grounds to open up the country. He says there is, what was the word he used? There is no yeah. He said that the reporter asked him, would it be a smart, easy, quick way to reopen the country if we had enough test kits to have everybody tested? So you find out that nobody has it. And he said the following idiotic statement. He said that even if we had everybody tested in America, that would not conflate to reopening the country. What? You know that everybody doesn't have it. And that would not give you grounds to open the country. And nobody has it. Oh my God. I again plead with Donald Trump to fire these 3 pinheads. Or put them someplace else and put people who are honest in their positions. Okay. Another story that we have about COVID-19 as far as how serious all of this is. We thought it was very curious to say, how is it that California had so few cases of COVID-19, so few deaths? Well, one of the theories is that a lot of people travel from China to California throughout the year. Okay? A lot of people travel from China to California throughout the year. And if you go back and look at the internet stories from the California newspapers in November of last year, was an interestingly high number of flu cases that they had. Never seen before. Go look it up. Go to any California website and look at their headlines from November of last year. And what you find is that California reported on their websites, their newspapers, that they were having an unusually high number of flu cases. Same people affected. People of different ages got it. The elderly with respiratory issues died from it. The young people died from it. But it it actually had less of an impact in the death toll than the flu did. In fact, I think if I remember correctly, there were 60,000 flu deaths in America 2 months ago. So this flu not only came through, but it didn't kill anywhere near as many people as reported death of the flu, right? So, what was this? What was this virus that California got in November of last year that everybody thought was the flu? It seemed like a severe cold, but yet everybody got over it within a span of a month, and now they have no more cases. Could it be that it was COVID-19 that was running around in California in November? And it killed far fewer people than the flu did. Far fewer people than the flu. And they got along just fine. And no need to shut anything down. It came and it went. And now we have such a small number of cases in the last 2 months because of something called herd immunity. HERD. Where if you've been exposed to a virus that you're either immune to or had it and didn't die from it and were never sick enough to even miss a day of work, you're immune to it. It's called herd immunity, when large groups of people are exposed to a virus and they become immune to it after it's passed through. So, if this is the case, which it's panning out all over the country, except for in New York where the governor's a total buffoon idiot. Okay. Why did we shut down the country for? Well, that's an interesting question. The answer is it's an election year. And what I think is really, really... How much time have we gone so far?
21 minutes.
21 minutes, okay.
22.
What is going to be absolutely confounding when this is all over with is how, when the death toll comes down to the accurate number, it's going to come down about 8,000, I would think. Death toll is going to come down to at least 8. Death toll is going to come down at least 800 cases, not to 8,000. The death toll is going to come down 8,000 cases. Not 800, not 8,000 total. I don't think any more than 2,000 people have died nationwide from this. I believe the American people will and ought to be completely embarrassed by the fact that they gave in to all this social distancing nonsense and they didn't push back against it. Quickly about churches, well, I told my friend the other day that, I really thought that I was being too hard on the churches in America. Am I tired of the crud messages? But I don't. I should be a lot harder on the churches because there's so few leaders that actually have any guts. Churches have laid down and rolled over nothing. When several liberal governors have admitted through anonymous sources that their sole purpose in shutting down the state was to shut down the expletive churches, and all the leaders of churches have done is just rolled over and taken it. Oh, God is sovereign. We trust in the Lord. Really? Sounds to me like you're scared. Let me tell you why they're scared. They're scared of getting fined, scared of being put in jail for standing up for the faith. And the Bible says that when the government official issues a decree that you know is against the Bible, you ignore it. Well, the Bible commands us to assemble. Most churches in this country didn't even try to alter their services to accommodate people. There's that option. It was originally 100 people. There are a lot of churches that could have added services on multiple days of the week to accommodate having only 100 people in a group at one time, and they did nothing. Okay? So, they're afraid of getting sued. I heard one of them admit it. Okay, let me ask you this question. If a person comes to your church and within, a week, tests positive for COVID-19, was the church the only place that person went? Huh? Is the church the only place that person went? I doubt it. That person could have caught it from anybody. That person could have gone for a walk and walked by somebody and caught it. Half the people out there have masks on, half of them don't. So how are you going to be worried about being sued because somebody came to your church when there's no way that person can prove that that is where they got it? How about this, pastor, church person, church leader? If you're not having services, then you're not doing your job. So, as part of your church closer, how's about handing back over that check? Huh? How's about you giving that check back and find some other way to feed yourself and your kids for that week or 2 weeks or 3 weeks? How about that? Nope, but you're sitting right at home, taking it easy, chilling out, cowering under the governor's order, eating, drinking, and sleeping when you should be in jail. For the right reason. Isn't that what we're called to do? To go to jail for the right reason. To be a hero. To be a leader. To be somebody that somebody looks up to. Your kids are proud of you. I tell you what, if my dad was a pastor and he got arrested for having a church service over a bogus executive order, and my dad had to spend, 2 days in jail, and people came forward to bail him out and provide him with legal assistance, I would be so proud of my dad I wouldn't know what to do about it. And so would Jesus. You would have treasure in heaven for spending those 2 nights in jail. Treasure in heaven. Instead, I hear this, oh, God is sovereign. He understands. No, I don't. What I understand is that you need to resign. So, that's my 2 cents on that. It's 30 minutes?